Okay, we're ready to get started again. We're looking at the marking and identification of free-roaming animals, and I'm going to introduce two of our ACC&D staff, which I think you know them both rather well by now. Have our Director of Programmes, Val Benker, and we have our Senior Coordinator, Susan Getty, so they'll be doing our next session.
Hello again. So Susan and I will be talking about ACC&D's initiative to determine a method to mark and identify free-roaming dogs and cats. So I will... There we go. I'll share a bit of the history of the project and a few studies that have been completed, including the more technical aspect of the Kenya marking study. I'm conscious that for some of you, this will be repetitive, and I certainly don't want to bore you, but I also want to make sure that it is informative for those of you who have not heard about the studies to date. So Susan will then turn to the more exciting role of telling you about a promising new approach in the works with a microneedle patch. So the goal of this project is to identify a new method or improve upon an existing method to mark animals as non-surgically sterilized or contracepted. So this flags two criteria right off the bat. One, that the application needs to be possible in a non-anesthetized animal. And second, that we may need to transfer or convey information about the date of treatment. If we consider that some contraceptives will require retreatment. And this, incidentally, would also make the mark useful for other purposes like rabies vaccination. We started with a think tank in 2013, which was generously sponsored by PetSmart Charities, which allowed us to tap into the expertise of a range of backgrounds working with several different species. The think tank also enabled us to review the currently available options for marking animals, some of which you see here. Various types of metal and plastic ear tags, freeze branding, leg banding, tattooing, keeping a log of individual animals. None of these existing methods fulfilled our needs per se, but several provided potential departure points for future development. At the think tank, we also established criteria for marking, for the marking features that we needed to fulfill our particular niche. So we created this handy table to summarize the key criteria. On the middle column, you can see what we would accept at minimum, and in the right column, you can see what was our ideal. In short, the ideal was long-range visibility, permanence, no behavioral impact, quick, easy, painless, and inexpensive. Based on these criteria and what has been successful in other species, we started to look at improving ear tags for dogs and cats. Ear tags were already being used in some locations for dogs. I took a picture of this pup in Istanbul, but they experienced certain limitations and challenges. I won't focus too much on this slide, but I would be remiss not to acknowledge that we found a really fantastic partner in Cornell University for the research and development phase, including access and provided manpower, grants, and expertise, and there were also many other partners who were really critical. The development phase benefited from a wide range of input. Included textile scientists at Cornell to human body piercing experts in Portland. And with that, we came up with a visible and durable tag applied with an already commercially available, off-the-shelf, and very affordable applicator that is actually usually used for tagging clothes using nylon or polypropylene fasteners. And you can see that in the upper right-hand corner. Okay, So once we established a prototype, tag, and applicator, we were ready to pilot and conduct some early field studies in dogs and cats. So I'll go through each of them chronologically, since each one built on learnings of the prior. The first study, which was conducted in Romania, is entirely the work of a Cornell veterinary student, Eloise Cucci, and these are her photos and data. The study took place in a shelter in Romania where Eloise has family. Dogs had tags applied while they were under anesthesia for sterilization surgery, and observations were recorded on the days that you see listed after application. Eloise's conclusions were as follows. First, the applicator works really well in anesthetized animals. Tags did not cause infection or pain, but we certainly need to consider that the animals who were tagged were concurrently treated with antibiotics and analgesics related to surgery, and these certainly could have contributed to the healthy response to the tags. And the third point is that the tag visibility was not always ideal, especially over time. So an RFID component attached to the tag would be beneficial. Tag loss was low, with 5 out of 54 dogs having a tag fall out during the course of the study. But this is nonetheless still a significant concern. It is worth noting, though, that 4 out of the 5 dogs were co-housed puppies who did not have a whole lot of alternative enrichment than each other's ears. So we hoped that tags would perform better in dogs living in a more normal home or free-ranging environment with more to do than basically tug on each other's ears. And one point here is also to note that the tag failed at the polypropylene fastener. It was not due to damage to the ear. Basically, the little fastener portion just snapped. The tags looked promising from this first pilot. We could see that once fitted, they did not bother the dogs and they caused no physical harm. But there were clearly some outstanding questions, including long-term duration and how conscious animals would tolerate tag application. And of course, the other important question was, would this work in cats? That led to our second pilot study on pet cats, which was launched in March of 2016 with a grant from the ASPCA. Our board member, Dr. Amy Fisher, generously volunteered 9 of her indoor-outdoor pet cats for this study, and tags were applied while the cats were under anesthesia for routine dentals, and the same monitoring and observation protocol was used for this study as had been used in Romania. The outcome for the ears was good. Some cats developed slight scabbing where the needle was inserted, but it was not bothersome, and the skin underneath was very healthy. Eight cats exhibited completely normal behavior throughout. 1 female exhibited transient ear flicking and head shaking for a short while. There was no change in behavior towards the tagged cats. Everyone continued to headbutt each other like nothing had changed. So that was great. Tag loss was, again, a concern. We had 3 of 9 cats lose their tags in the first few weeks after application. It's worth noting that 2 of these were young, rambunctious males, and 1 had lost his collar at the same time that he came home without a tag. Again, fortunately, the tag loss was due to the failure of the fastener, not damage to the ear, and you can see that in this really excellent photo provided by Amy. So although we were happy that the cats seemed to tolerate the tags well, we did want to look at alternatives and options for different thicknesses and materials for the fasteners to try to get a better result with retention. And at this stage, we also started to look at options for testing the tag in a field setting for dogs, in a quote-unquote real-world setting. We sought a place where we could benefit the dogs receiving tags and where identification offered value to the animals. So I won't get into all the details about how we chose Laikipia, Kenya, since I spoke a little bit about that in yesterday's panel. But the bottom line is that we worked with a Smithsonian-affiliated study in Laikipia, and that ran in conjunction with a large-scale rabies vaccination campaign. The main objectives of this study were twofold. First, to evaluate the practicality and humaneness of tag application in conscious dogs, and second, to evaluate tag performance over an extended period using a stronger nylon fastener as opposed to the polypropylene that we had used previously. The study population was free-roaming owned dogs with informed owner consent. As Dr. Rowan mentioned, it's hard to achieve, but we certainly did our best. We aimed to not just tag the first 100 dogs that came along with owner permission, but to select dogs that had remained calm and stable through the first phase of handling rabies vaccination and dewormer. And that was part of the main rabies vaccination project. Many dogs found that process stressful, and we didn't want to test our tags on dogs that were already anxious, stressed, and vocalizing. Before tagging, we sprayed the ear with ethyl chloride anesthetic spray, which was a recommendation that came from a board-certified anesthesiologist. And that was the way to provide some kind of numbing and pain prevention without using any kind of sedation or anesthesia. So there were several learnings from this study. The first was that dogs did not tolerate the tag application well. They exhibited signs of acute pain, including a lot of vocalization. And related to that, ethyl chloride did not have the anesthetic effect that we had hoped. We attempted tagging in 6 dogs. 4 were successful. 2 I aborted because of the dog's response, and at this stage I stopped the study on welfare grounds. The encouraging news here is that the indicators of pain and distress were transient. Vocalizing did not persist, and within minutes dogs were really walking around normally. No rubbing, scratching the ear. They were doing all the things that dogs do. The unfortunate part, in addition to the dog's reactions, was that there was a very, very high rate of tag loss. We were able to follow 3 of the 4 dogs throughout, and all 3 lost their tags by the 16th day. So based on this conclusion, or based on this experience, we decided to suspend further studies of this particular prototype in dogs. This is based on a combination of factors stacked against the ear tagging in dogs at this point. The dogs' indications of pain, limited anesthetic options that are currently available for field use, and concerns over tag loss. While many of these things alone would not be insurmountable, in combination, they do lead us to believe that it does not seem viable to move forward with tagging in conscious dogs using this method. We view cats somewhat differently in that tagging a free-roaming or feral cat would require heavy sedation, and with that can come pain management. So with a stronger fastener, we think that there could still be some promise in cats. However, at this point, we are not actively pursuing this, particularly because there's another promising tool that has emerged. And with that, I hand the mic over to Susan.
All right. Can everyone hear me? Okay. So, all right. So Val talked to you about tags, and I'm going to talk to you about microneedle patches. So last year we established a partnership with Dr. Mark Prosnitz and the Georgia Institute of Technology. Dr. Prosnitz and his colleagues carry out research on biophysical methods of drug delivery, including the use of microneedle patches to deliver the flu vaccine. Microneedle patches, as you can see, are quite small. The needle part itself is only 1 centimeter by 1 centimeter. And the way it works is you basically take the sticky patch applicator and you put it on your wrist and hold it, and the needles and the vaccine dissolve into the skin. In a study of 100 human participants, the patch was well tolerated. It was reportedly painless, and there were minimal local reactions. To me, this sounds like a lot more fun than the traditional flu vaccine shot. So, I'll get the hang of this, don't worry. Perfect. So what ACC&D is exploring is the idea of using these microneedle patches to administer tattoo ink to the inside of a dog or a cat's ear to indicate that the dog or cat has been non-surgically sterilized and or vaccinated. So as you can see, perhaps color indicates gender, or the number indicates the year that the animal has been sterilized or vaccinated. Sorry. The other possibility is using UV ink. Joyce purchased these UV ink markers, and we used her volunteer animals, her cat, Philip, and her dog, Leo, and we just drew a little tiny mark on the inside of their ear, and then when you flash the ear with the light, it shows up quite nicely. Some of the colors worked better than others, but the blue worked pretty well. So in exploring the idea of using these microneedle patches, we went back to our chart that Val had showed before, the minimum and the ideal criteria, such as visibility and permanence and whatnot. So as for time required for application, Dr. Prosnitz believes it's possible to get to the time of application to a matter of seconds. He also guesses that the cost per patch could be under $1, so this is quite affordable. As for training required, considering the patches were successfully administered in the flu vaccine study, we can assume that little to no training would be needed for how to apply these patches to the dogs or the cats. As for pain level, we have one study that suggests minimal pain in application. So this study was a proof of concept study published in 2016. It was done by Dr. Mark Prosnitz and Muriel. So 5 of the beagle dogs were given the vaccine by intramuscular injection, 5 with 50 micrograms of a vaccine in a microneedle patch, 5 with 5 micrograms of vaccine in a microneedle patch, 2 with a placebo microneedle patch. 4 weeks after the initial dose, the same dogs were given a booster using the same delivery mechanism. The patches were administered to the inner ear, which they did shave. The patch was pushed into the skin, held for 1 minute, and then held additionally for 15 minutes with vet wrap. It's important to note that in this study, no sedation or pain relief was given. So intolerance was indicated by vocalization, withdrawal, or attempted biting. During prime vaccination, 60% of the dogs given the IM injection were intolerant of the injection, versus none of any in any of the microneedle groups. During boost vaccination, none of the dogs in the IM injection group were intolerant, versus 1 dog in the microneedle group. The vaccination sites were also monitored for local skin reactions. So image B on the right is what the skin looked like immediately after removal of the patch. 100% of the dogs in the microneedle vaccination groups showed redness at the vaccination site, whereas only 50% of the dogs in the microneedle placebo group showed redness. But most of the redness was resolved within 7 days. And just as an FYI, the antibody titers after vaccination by the microneedle patch were similar to the responses to the IM vaccines at the same dose. So there's promise there. So just going back to this chart, We have some data to suggest that the patch application is painless and causes minimal site reactions, and we have a pretty good idea that the patch could be applied quickly and with minimal training and cost. For ACC&D, this was enough to move forward to work with Dr. Prosnitz to see if the patches could hold ink instead of a vaccine. And it worked. Dr. Prosnitz and his student were able to load the microneedle patch with blue tattoo ink, as you can see here. The next step, of course, was to administer the patch to an actual ear. The patch was placed on a cadaver pig's ear, which was not shaved. Was not shaved, so there was some hair. It was pressed on and left for 10 to 15 minutes, and this worked too, as you can see. But the question next is, what about visibility? So this is an image of the ear taken from 1.5 feet away, which is pretty good. And then here's that same image, just shrunken in size. We don't have the ear here to do up close. And then here's the mark. This photo was taken from 3 feet away. So it's not bad. So the immediate next steps are to fashion the ink into a number and to add UV ink. So Dr. Prosnitz is working on that now and should have some results fairly soon. Down the road, we're going to see if we can get the patch application down to a matter of seconds, and or to fashion a patch with a biodegradable backing. I do believe that biodegradable adhesives are already possible, so that we just have to put it all together. And the idea behind the latter is that you don't really have 10 to 15 minutes to stand there and hold the patch on while doing things like vaccinating a feral cat. But you could press the patch with the adhesive onto the ear and then release the cat, and the patch would fall off and then biodegrade after 10 to 15 minutes. Or it wouldn't biodegrade after 10 to 15 minutes, but you get the idea. And then just to go back to this chart one last time, we do recognize that there are some potential problems. One of them is visibility. It did look good in the pictures, but what does it look like in real life? Not to mention, dog ear structure has the potential to reduce visibility, so a tattoo might show up really well in the dog on the top left corner, but what about the dog with floppy ears on the right, or the black cat with the curved ears and the hair? Likely the microneedle patch tattoo won't show up quite as well. But we do believe it has enough promise to continue exploring, and so perhaps this tattoo could be used in conjunction with a more temporary marker like a collar. So as for use of this patch in the field, we can see it working where dogs are restrained or vaccinated, restrained for vaccination or sterilization non-surgically. For cats, we believe it's likely, as Val said, that the cat would need to be sedated for treatment anyway, and this will allow us to apply the patch. But for those of you who work in the field, which I do not, we welcome your feedback. So we were wondering how you see it being used, when you think it would work and when it wouldn't work. If we couldn't get the application time down to a matter of seconds, do you think it is possible to adhere this patch to the inside of the cat's or to the dog's ear with something sticky and then have it fall off? Does that seem viable? And we welcome your feedback either now or by email, which I should have provided to you, but I can. Please come up to me after and I'll provide an email address. That's it.
Thank you, Val. Thank you, Susan. Any questions from the floor or comments, thoughts on the microneedle patch or otherwise? Have we got a mic? Thank you.
I guess my only comment would be, in the thoroughbred racehorses, they tattoo the lip, and that gets really fuzzy after they're about 4 or 5 years old.
Yeah, and with the sunlight over time, would the tattoo fade? I'm not sure. That's another thing we would have to test.
So you would use UV ink so these animals would actually glow in the dark? Is that, I think it's adorable. I'm wondering about feral cats, though, if there's going to be issues with them glowing in the dark.
What do you mean?
Just to explain, the UV ink will glow if you shine a UV strength
Only a
torch
UV light,
on it.
so it's not that they would
Yeah, it's not a fluorescent ink. It's,
Okay.
You would shine a torch on it that had a
Okay.
strong UV component to the frequency
Okay.
of the light, and then the UV
I
should
see.
bounce back at you. But
Perfect.
you wouldn't be able to see it the rest of the time. Have you ever seen
Yeah,
tattoos
yeah.
on people, the ones that you can't see during the day?
I
They have
don't go
facial
to clubs
tattoos?
anymore, but
Yeah,
I think
those
I
guys.
remember. Yeah.
Yeah, so those guys who go to clubs, some of them have these sort of secret tattoos that you see in the
Yeah.
club when the UV lights are on, but you don't see it during the day when they're
That's
your
perfect.
bank manager.
I was just wondering if they would have trouble hunting or something like that because they would be visual, but it sounds like no. So
Yeah.
that's great.
I would just add as well that topic, the issue that you're raising was one that we talked about fairly extensively at the think tank 5 years ago about how do you have something that is visible but that doesn't compromise the animal's safety and welfare.
I just wanted to add something that I just learned because I really want to try to foster some more, but I have 5 residents in my house that want to spray. Anyway, so I was looking for a better alternative than carrying around this long fluorescent light to see if the boys were behaving. Anyway, apparently you can take your smartphone and put like a layer of blue tape and a layer of red tape, and you can make your own fluorescent light.
Interesting.
And that might not be perfect. Google it.
I mean, I think it sounds really exciting. I mean, so I work in Thailand and throughout Southeast Asia, and so we use tattoo pliers, and so it's similar. I mean, in the design with the letters or the numbers in the ear, and it certainly provides us with a lot of information on that animal, the year it's sterilized, and the area that it came from. I think the issue always, and the reason we do that is because ear notching and even the tagging is not very culturally palatable, particularly in the Buddhist communities that we work in. And so we, pursue the tattooing. I think the issue, and I know I'm stating the obvious here, is always that how do we do a survey after the fact to know, to calculate the population sterilized, the percent sterilized. And so obviously it's not very effective to run around and look in dogs' ears, and it also grossly overestimates your sterilization percentage because you're counting the friendly dogs that you can look inside their pinna. And so that's just my concern is that, obviously for male dogs it's more visible, but for the female dogs it doesn't really address that concern.
Yeah, that's a good point. I guess you could fall back on just looking at the proportion of dogs with pointy pinna and what proportion of those have marks in, on the basis that you're probably not sterilizing floppy versus pointy, but it is a bit dubious. When we look at cats, hopefully because they have these lovely pointy ears all the time, although we have the issue with the black cats, we hopefully will be able to continue to do surveys as we do with the ear tips, using the site of the tattoo with the cats. But with the dogs it is a question. I guess we would hopefully be able to still rely on those dogs that we can see and look at proportion of those with visible pinna, nice pointy bat ears like the one in the photo, and see what proportion of those are sterilised. But it is a challenge. One thing we did talk about, especially with dogs, was that you could combine them with a collar, and then you have a chance later on if there's because you have collar loss, but then you have the permanent tattoo, so maybe you could go back and replace the collar on the ones with the tattoo that have lost it. But yeah, it's imperfect, but we're getting closer, I guess, is the idea.
I was wondering whether two questions. One is, you mentioned Turkey and the little plastic tags. Why are they not used, or what is your idea? Why do you feel they're not used?
So there's been sort of mixed reports on how dogs have done with those long term in terms of scabbing and infection. That photo was a livestock tag, which is a much thicker post that went through, and combined with that, that even though it's done in conscious livestock, it is painful. It's an incredibly painful process. So we were looking for something that would be finer and more humane. The one thing that I didn't mention in the presentation was the way that that the traditional livestock tags go through are basically they have a really sharp point, and you force them through the tissue, and so you get a little flap of skin that sort of comes out the other end. And with the applicator that we were using, it basically cores out a little piece of the tissue, and then it pushes the fastener through. So that that was our lovely Portland-based body piercing friends recommended that as the much preferred option in terms of pain and also healing speed.
Okay, thank you. And another for Susan, just quickly. I was wondering whether you are initially maybe over-ambitious with the colors and the numbers. Maybe if you increase the density of dots, could you have a better mark? Just to start as all the dogs that have a black dot are done.
Yeah, no, I do think it's going to be tricky once we try to fashion numbers. The visibility was good, but it wasn't great. And I think in our minimum, or our ideal criteria, it was 12 feet away. I don't know that we're going to be able to see a number fashioned out of the needles from 12 feet away. We might be able to see a more dense mark, like you're saying. As for how many needles can be put into the 1 centimeter by 1 centimeter, I don't know that. That would be a question for Dr. Prosnitz. Yeah.
I think we have time for one more question, maybe at the back.
Yeah. So I wasn't sure if any tattoo of the microneedles had been done on any live subjects yet. I'm just interested because it seems like there's such a very shallow penetration of the microneedles so that they aren't feeling pain. And the test was done on skin that isn't healing, undergoing a healing process. Just as a human who has had several tattoos, it is usually quite a painful process, and the ink has to be deposited rather deeply to have a lasting effect. So I was wondering if that would be a challenge going forward and figuring out how do we use this in skin that is going to heal and kind of continue to change over time so that that mark will still be visible and still be functional in identifying that animal.
Yeah, I mean, I think there's a lot that we don't know. We're just sort of starting this process, and I think we're going to have to kind of figure things out as we go. With regards to like local skin reactions, in that vaccination study with the rabies, most of the, or I guess it was 50% of the placebo microneedle patches showed redness, whereas 100% with the vaccine showed redness. That might give some indication as to how the ink will do as far as like whether or not it'll cause a reaction. But yeah, I mean, a lot of this we just don't know yet until we try it.
I'll just add one more point. As Susan said, there's still a lot that we have yet to learn. It is very challenging to find literature on the thickness of different layers of ear tissue in cats and dogs. But we found one study where they had actually measured everything in cats. And the proportions of the epidermis, dermal layers were quite different than in people. And so I think there's a possibility that even though it's much shallower, it will, it might be able to get deep enough into the tissue in a cat or in a dog without triggering the pain receptors in the same way that it does in a human. But again, as Susan said, we're still in the early stages.
We're aiming to get through the epidermis and into the dermis, so down to that layer that won't grow out, and we're just hoping that will be shallow enough in the ear, just as Val said. So, but it's a really good point. We need this to be permanent, so it needs to go deep enough to be permanent. Okay, we are at time. Thank you to Val and Susan. We're now going to break for lunch. Our thanks to PetSmart Charities for supporting the cost of our refreshments, and we are going to be in Washington or Empire.